Hey everyone, it's Sonia here. Big news, the World Health Organization has declared that the monkeypox is a global health emergency. So I want to give you the rundown on what's going on with the monkeypox and why they have done this and actually how this came about and what might be some of the reasons behind why they did this. If you like the video, thank you for hitting like, thank you for subscribing, thank you for your support on Patreon that keeps my channel going. And I'd like to let you know, if you've ever kind of been thinking about getting yourself a really great HEPA filter that removes all the little particles in the air that you don't want to have there, Proton Pure is running a special right now where you can get their air filter for 50% off. And what's really great about this one is that it filters much more than any regular HEPA filter. It's 99.7% of indoor air pollutants. It catches the larger particles, microscopic particles, and even chlorine, volatile organic compounds, smoke, some forms of alcohol, and unwanted odors inside the home. So if you're interested, I'm going to leave you a link below. I am not getting paid to say this, but I do have an affiliate link, and if you use my affiliate link, you can get 50% off. So the WHO has declared the highest alert over this monkeypox outbreak. More than 16,000 cases have now been reported from 75 countries. Surprisingly, there have been only 5 deaths, all of which have been in Africa. So just to put it into perspective, it's been spreading very quickly, but so far it hasn't been very deadly. Now, if you look up statistics about monkeypox for this year, you'll find that there have been actually a total of 78 deaths in Africa. But I think what's happening is that the rest of the deaths, the 73, are just not part of this outbreak, because monkeypox is endemic in Africa and they always have some cases and some deaths. So it seems to me that they're separating the endemic monkeypox in Africa with the 73 deaths that are recorded for this year versus the global outbreak and the 5 deaths that are part of that, which also happen to be in Africa. So what happened was that in June, the WHO convened a panel to discuss whether monkeypox should be declared a global health emergency, and they decided no. They then reconvened for another panel meeting just a couple of days ago, July 2022. And actually, the panel did not want to declare it a public health emergency. They didn't arrive at a consensus agreeing to do that. The emergency committee had been unable to reach a consensus on whether the monkeypox outbreak should be classified as a global health emergency. But the WHO chief overruled the panel to call monkeypox a global emergency.
For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
Dr. Tedros kind of overruled that and told them, listen people, it's an emergency. You're going to have to declare it an emergency. So says me. So they declared it an emergency. What does this mean now? 2 weeks to flatten the curve? I don't think that they're going to go that route. I think it's going to be a hard sell after what we've just been through. Now, there is a vaccine that's being used against monkeypox. They're now giving out something called Imvamune. According to the Canadian National Advisory Committee on Immunization, Imvamune is actually a non-replicating third-generation smallpox vaccine, not a specifically monkeypox vaccine, and in fact there is very limited evidence available regarding how it is going to affect people who receive it for monkeypox. They don't have a whole ton of safety data. They don't really know the durability of the immune response. But of note, interestingly, the World Health Organization has warned people that if they take this vaccine for monkeypox, they are actually participating in a clinical trial.
I would like to underline one thing that is very important to WHO. We do have uncertainties around the effectiveness of this vaccine. vaccines because they haven't been used in this context and in this scale before. And therefore, that when these vaccines are being delivered, that they are delivered in a context of clinical trial studies and prospectively collecting this data to increase our understanding on the effectiveness of these vaccines. Thank you.
Well, at least they're giving them fair warning so they can give informed consent. Unlike with the COVID vaccine, which, although the trials aren't actually finished, don't send me to the meat grinder. I don't think you're supposed to say it's experimental. It was approved for emergency use, and that's good enough for you. Anyway, with the monkeypox vaccine, they are telling people that it is experimental and they're participating in a trial. It's kind of weird. All right, I'm going to give you my 2 cents here. It is a little bit weird that they're declaring it a global health emergency because, and I'm not an expert, I'm just going on what I've seen in the news. So far, this seems to be acting as a form of an STD. Usually it was not considered an STD, but it's acting like an STD now. It used to give people mostly sores on their hands and face and then spread to the body. Now it's giving them on the private parts and they're getting them through sexual contact. So basically it is acting like an STD. And like the WHO said, it's affecting a subset of the population mostly, which is men who have sex with men.
Is all reported with men who have sex with men. Do you fear that the governments might not take this feat as seriously as the COVID?
Thank you very much, Jeremy. Good question. I guess we'll go to Dr. McBride.
It is important both that it is taken seriously and we make collective efforts to support the community affected and the experience that they have had as the most at-risk group, and in this case it's men who have sex with men.
I wonder why. It could be that gay sex is riskier when it comes to catching monkeypox, because I'm pretty sure the virus doesn't really care who you're attracted to. So it can't just be the fact that they're gay. It must be something that they're doing in particular. The WHO says this outbreak is not comparable to COVID in the sense that COVID was very easily, widely transmissible, whereas this, you have to kind of go out of your way to catch it for the most part. So why is it an emergency? I mean, basically there's a new STD out there, mostly affects gay people. Could affect anybody, but so far it's mostly gay people. The LGBTQ community doesn't want there to be any stigma, and rightfully so, but I mean, look, anyway, that's what the WHO is saying. So they're giving out these vaccines, and they're actually giving them here in Montreal at a clinic not far from my house. And I was myself at this clinic for another reason. I'd seen the booth where they like sign people up for the monkeypox shot, and there was a woman there and she wanted the vaccine, and she was telling the person, I spent the whole night with someone who has now been diagnosed with monkeypox. She didn't have relations with that person, she just had close contact, but she's certainly a contact. But they wouldn't give her the monkeypox shot. They said it's because she wasn't a gay man. And the woman was really upset, and she said it was discriminatory. So I don't know how it is in other places, but it seems like in Montreal, at least in the clinic in my neighborhood, they're only giving it to gay men. Maybe health workers as well, but apparently not just anybody can walk in there and get it. So why does the WHO consider this such an emergency? I mean, it is an emerging disease. I can understand that they're concerned, but why a global health emergency? At this point, it just kind of seems like it's a new STD. It's really not that deadly. Is this a reason to call for a global health emergency? Maybe it is. But some people think there could be other reasons behind that call, such as the push for the WHO pandemic treaty, which flopped the last time they tried to get it to go through. There had been some articles recently promoting this treaty and why it would help the whole world, for example, by improving distribution of vaccines and medications during pandemics. A treaty to break the pandemic cycle. Don't ignore key lessons from the past 2 years. So basically what this treaty would do would be all those nations that signed to it, if there was a pandemic, they would be directly under the direction of the WHO. And hopefully that way things would get handled a little better. In this past pandemic, technically we're supposed to be under orders of the WHO, and it's like in some areas our governments follow them and in others they don't. For example, recommendations for vaccines, largely they followed it, but not 100%, and every country was different to some degree. For other things, they completely disregarded the advice of the WHO, such as when the WHO said that we shouldn't be having lockdowns, we had lockdowns anyway. Nobody was listening to the WHO that time. They also recommended against using vaccine passports for travel. They said it didn't make any sense since the virus was everywhere anyway. Did Canada listen? No. And in fact, we still have certain restrictions on unvaccinated people, even now, that they're allowed to travel. They're the only ones who have to do quarantine, even though we know that vaccinated people can also catch the virus and pass it on to other people. So it seemed like the WHO sometimes had some advice that actually might have been good, and nobody listened. On the other hand, a lot of people are concerned that if we give too much power to the WHO, it'll remove our sovereignty when it comes to these matters, and that it really shouldn't be a supranational body dictating to us what to do. They can give recommendations, but we should be able to choose to follow them or not. One of the biggest issues here was the question of vaccines. Canada bought something like enough shots to give every person 8 or 10 shots. I'm not sure if it was 8 or 10, but it was a lot. We're on the 4th at this point, and really not everyone's up for it. And a lot of vaccines are going in the garbage. The WHO had been saying this whole time, stop hoarding the vaccines, send them to the third world, send them to Africa. As you may know, if you've looked it up, African countries have very low vaccination rates. They didn't get their share of vaccines. As it turns out, though, they've done quite well during this pandemic, and a lot of those countries really didn't want the vaccines. So I'm not sure what the WHO would like us to do differently now at this point. Maybe for the next pandemic, ensure that vaccine distribution is more equitable. But for this one, with the vaccine that we have right now, it seems kind of like it's water under the bridge. It's a bit late in the game, you know? Now, I may be wrong about that, so if I am, don't send me the meat grinder. It's just my humble observation. So the idea is that the WHO is going to do a better job, and they're going to make sure that access to medications and vaccines is more equitable, and the third world, and especially Africa, doesn't get left behind if something like this were to happen again. Now, not everyone has been in support of this treaty. Here's an article from Financial Times. Monkeypox makes pledges of pandemic solidarity look hollow. The global south has once again been abandoned in its quest for vaccines. Yeah, so that's, I guess, what the WHO is trying to avoid. But would this treaty really solve the problem? Mark Eccleston-Turner, an expert on global health law at King's College London, says the treaty may fail because it is a neo-colonial instrument designed to crystallize rather than erase the power imbalance between nations. Early versions, he says, seem to force low and middle income countries to promptly share samples and data, giving other countries time to close borders and stockpile drugs, vaccines, and protective equipment, but without enshrining equitable access to those drugs and vaccines in return. So who knows? Maybe it would be more equitable. Maybe it would be less. And right around when the WHO had this second meeting in which Dr. Ted decided to just tell the panel what to do, pandemic treaty talks resume amidst lurking corporate pressure. Well, basically, it looks like corporations like to use situations like COVID-19 to make as much money as they possibly can. Unless profiteering from illness stops, corporations which are becoming richer even during disasters and pandemics will continue to pressure governments to not advance pro-people policies. Really? I had no idea. Normalization of minting unbridled profits from illness is one of the reasons why health and social welfare programs have failed to deliver equitably. They're trying to talk up this pandemic treaty and really make it sound like it's going to be a great solution to all the problems that we've had. But on the other hand, it gives the WHO an enormous amount of power. And not everyone's comfortable with that. And some people think that the reason that they're declaring the monkeypox outbreak a global health emergency is just to sort of put more pressure on, so that the nations will be more likely to approve the pandemic treaty. I'm not sure if that is really the case, but this is what some people are saying. So we'll see how this turns out. So that's the update. Let me know what you think. Thanks for leaving me your comments. Thank you for liking the video. Thanks for your support on Patreon. That keeps my channel going. Don't forget to check out the link for the Proton Pure air purifier. And thanks for listening to me, and I'll see you next time.